Hello everyone, today we will discuss about anatomy of the knee joint. Any of the joint we discuss under following headings. First is the type of joint, then articular surfaces, factor providing stability to the joint, ligaments, bursas, relations around the joint, blood supply and the nerve supply, movements at the joint and the muscles which are responsible for those movements, and the applied anatomy. So we start the knee joint. It is the largest joint of our body and it is very complicated joint. Why it is complicated? Because it is made up of three joints. It is made up of two condylar joints, that is between medial and lateral condyles of the femur and tibia, and the femoropatellar joint. So it is made up of three joints. Then it is relatively weak joint because articular surfaces are not fully concurrent. Then type of joint, it is a compound synovial type of joint. And why it is compound? Because it is made up of three bones. Now complex joint, here the joint cavity is divided by a menisci or a articular disc into two compartments. Here is the articular disc. This bluish one is the menisci which divide the joint cavity into upper menisco-femoral compartment, and the lower one will be the menisco-tibial compartment. So the joint cavity is divided by menisci into two compartments. Now it is functionally condylar joint because two condyles are there, femoral and tibial condyles. So medial and lateral femorocondylar joint, and it is a modified hinge of type of joint. Hinge type of joint is called as where the axis around one axis the movement is possible, but here it is called as modified hinge. Why it is modified hinge? Because axis of movement, that is the transverse axis, is not fixed, because during flexion this transverse axis will move backward, and during extension this transverse axis will move forwards. And also the thing that during flexion and extension which is occurring on the transverse axis, there will be some conjunct or the automatic rotation of the femur on tibia also. That's why it is called as modified hinge type of joint. Now articular surfaces, articular surfaces are condyles of the femur and tibia, and the trochlear articular surface of femur and patellar articular surfaces. So these are the articular surfaces of this joint. Now factors maintaining the stability of the joint. First is the muscles which are surrounding the joints. Second one is the on sides medial and lateral collateral ligaments. Here is the medial collateral ligament, and this one is the lateral collateral ligament, and this one is the medial collateral ligament. They are providing side to side stability. And here are the cruciate ligaments. They anterior cruciate and posterior cruciate ligament. They are providing anterior-posterior stability to the joint. So these are the factors which maintain stability. Now coming to the ligaments. First is the fibrous capsule. This fibrous capsule surround the joint cavity, the joint capsule. And the second ligament is the ligamentum patelli. Third is the tibial collateral ligament or the medial ligament. Fourth is the fibular collateral or the lateral ligament. Then oblique popliteal and arcuate popliteal ligament which are present on the posterior side. Then anterior and posterior cruciate ligaments, and medial and lateral meniscus and the transverse ligaments. First of all, about fibrous capsule. This any of the synovial joint, it is surrounded by a capsule, that is the fibrous capsule, and this capsule is very thin around the knee joint. If it would thick, then the movements possible will be very less. Then that's why the joint this joint capsule is very thin to provide mobility to the joint. And this capsule is deficient anteriorly. And why it is deficient anteriorly? This is deficient anteriorly to allow passage for the quadriceps femoris tendon and the ligamentum patelli and the patella. Now what is the attachment of the fibrous capsule? And this joint capsule is attached 0.5 to 1 centimeter from the margin of the articular surfaces. Green line is showing the attachment of the capsule. So above it is attached to the femur, and here you can see it is deficient to provide passage to the ligamentum patelli and quadriceps femoris and the patella. And lower down on the, it is also attached on the tibia near the articular surface from 0.5 to 1 centimeter distal to the articular surface, and here it is deficient where on the tibial tuberosity to provide passage for ligamentum patelli. And posteriorly it is continuous on the femur, but on the tibia it is deficient on the back to provide passage for the tendon of popliteus muscle. So this is the gap for providing passage to popliteus muscle. That this is attachment of the capsule. And one thing is also there, that on the lateral side of the femur, this provide passage for popliteus muscle. That's why this popliteus tendon is intracapsular. So this popliteus is within the fibrous capsule. That's why it is called as that popliteus is intracapsular extrasynovial tendon. Now joint capsule, on the inner side it is surrounded by synovial membrane. This brownish lining is the synovial membrane, and this is the joint cavity. Now coming to the ligamentum patelli, it is a tendon of quadriceps femoris muscle which is around 7.5 centimeter long, and it is attached to the apex of patella up to the tibial tuberosity. Now the medial collateral ligament or the tibial collateral ligament, which is 10 centimeter long, and it is attached superiorly to the medial condyle of a medial epicondyle of the femur, and below it divides into two parts, superficial longer part and deeper shorter part. This superficial longer part is attached to the medial border and medial surface of the tibia, and the deep smaller part, it is attached to the, it blends with the fibrous capsule, and also it is blending with the medial meniscus. So this tibial collateral ligament or the medial collateral ligament is attached to the, its fiber are, they are merging with the fibers of the menisci. And morphologically, this tibial collateral ligament represents the degenerated part of the adductor magnus muscle. This medial collateral ligament and lateral collateral ligament, they tightens in extension. Now the lateral collateral ligament or fibular collateral ligament, which represents the degenerated tendon of peroneus longus muscle, which is attached to the fibula, and here it is this is the fibular collateral ligament. It is attached above to the lateral epicondyle of the femur, and below it is attached to the head of fibula near its apex, and this tightens in extension. And this lateral collateral ligament is not merging with the fibrous capsule. It is also separate from the lateral meniscus by tendon of popliteus. But the medial collateral ligament is merging with the fibrous capsule and with the medial menisci. Now coming to the cruciate ligament, they are very thick, strong fibrous band. These are a bond of union between, direct bond of union between femur and tibia. These are the cruciate ligaments, and they represent the collateral ligaments of original femorotibial joint. They provide antero-posterior stability, means they maintain the relation between femur and tibia antero-posteriorly, and they are named according to attachment on tibia. If the anterior cruciate ligament is attached on the anteriorly on the tibia, and posterior cruciate ligament is attached posteriorly on tibia. So this is attached anteriorly, that's why it is called as ACL, anterior cruciate ligament, and this is called as posterior cruciate ligament because it is attached on posterior side of the tibia. Now what is attachment on of these cruciate ligaments and menisci on the superior surface of tibia? Here in this diagram you can see these are the cruciate ligament. This is the anterior cruciate ligament which is attached anterior side of the tibia, and this one is the posterior cruciate ligament. Now what is the attachment of the menisci and cruciate ligament? What will be the sequence on the intercondylar area of tibia? We can learn it by a mnemonic, that is Medical College Lucknow, Lucknow Medical College. First will be the anterior horn of the medial meniscus for M. Anterior first three के लिए आएगा हमारा anterior, तो here will be the anterior horn of medial meniscus, then anterior cruciate ligament and anterior horn of lateral meniscus. Then coming to the posterior part, posterior horn of lateral meniscus, posterior horn of medial meniscus and posterior cruciate ligament. So these are the attachments on the intercondylar area of tibia. This one is first three, we use anterior for those anterior horn, and the later three attachments are for posterior, they are on the posterior part. So these are the attachments on tibia. Now anterior cruciate ligament, it is attached, we call it anterior cruciate ligament because it is attached on the anterior part of the intercondylar area of tibia, and we can use the mnemonic for this attachment of this ACL, that is apple. We can say this anterior cruciate ligament is attached on the posterolateral part of the lateral condyle of tibia. Here you can see this is the anterior cruciate ligament which is attached on the anterior part, and it is running upward and laterally, upward, backward and laterally. So it is running posterolaterally, and it is attached on the medial aspect of the lateral condyle of the tibia, lateral condyle of femur. Now it is taught in extension, and it prevents anterior displacement of tibia on the femur. So both things about anterior cruciate ligament is said to be in terms of tibia, that it is preventing anterior displacement of tibia on the femur, and it is attached on the anterior aspect of the tibia. It is taught in extension, and it is preventing hyperextension, and it is present anteriorly, that's why it is more injured as compared to the posterior cruciate ligament. Then coming to the posterior cruciate ligament, this posterior cruciate ligament is attached on the posterior aspect of the tibia, and it is preventing the posterior displacement of tibia on femur, and it is taught during flexion of the knee. And for attachment of the PCL, we can remember it by a mnemonic palm, that PCL is fibers of the PCL, they are running anteromedially and they are attached on the medial condyle of the femur. Now for anterior cruciate ligament, we do the anterior drawer test, and for PCL we do the posterior drawer test. Now the ligaments which are present on the posterior side, there are called as posterior ligaments. One is the oblique popliteal ligament, which is the extension or expansion of semimembranous tendon. This is the semimembranous muscle tendon, and from this expansion, here you can see the expansion from this muscle. This is called as oblique popliteal ligament. And the second one is the arcuate popliteal ligament, which is attached to the head of fibula, and the Y-shaped fibers, the one stem of the fibers that is attached to the lateral condyle of the femur, and the other band of fibers going towards the intercondylar area of tibia. So from head of fibula, it is going to the lateral condyle of femur and the intercondylar area of tibia. Then the transverse ligament, here you can see this is the transverse ligament. This one is the transverse ligament which is connecting the anterior horns of both menisci, and it is not present in all individual, it is present only in 40% of the individuals. Now coronary ligament, it is the expansion of the fibrous capsule and it is connecting the menisci. Here you can see the menisci, and it is connecting the menisci with the tibial condyles. So this is the meniscus and it is connecting the menisci with the tibia. Now coming to the menisci, which is very important, they are the fibrocartilaginous disc, which is, they are dividing the joint cavity into two compartments. Upper is the meniscofemoral and lower one is the meniscotibial compartments. And because of this these menisci, which they are dividing the joint cavity into two compartments, that's why it is called as complex joint. And these menisci are crescent shaped. You can see here they are crescent shaped and they are attached to the tibia. They are deepening, what is the function? They are deepening the articular surface of the tibia, and here you can see they are vascular on the periphery and inner part is the avascular. So this inner avascular part is nourished by the synovial fluid, and outer part is vascular. Now what is the difference between lateral and the medial meniscus? Here you can see this one is the lateral meniscus, and it is more circular as compared to the lateral meniscus. So this is the lateral meniscus, which is more round or circular, and the lateral meniscus is and medial meniscus is somewhat oval. And the posterior end of the lateral meniscus is attached to the femur, medial condyle of femur, by ligament, by two bands of ligament, that is called as meniscofemoral ligaments, anterior and posterior meniscofemoral ligament. And this lateral meniscus is separate from the lateral collateral ligament, but the peripheral margin of tibial collateral ligament is adherent to the medial collateral ligament. And this medial collateral ligament is more liable to injury because it is relatively fixed by tibial collateral ligament, but the lateral collateral ligament is more mobile as compared to the medial collateral ligament, and this lateral collateral ligament bears more weight. So what is the difference between medial and lateral collateral ligament? That what is the difference between lateral meniscus and the medial meniscus? That lateral meniscus is somewhat round or circular, but the medial meniscus is somewhat oval or semicircular. Then the lateral meniscus remains separate from the capsule and the lateral collateral ligament, but the medial meniscus, fibers of the medial meniscus, they are adherent to the tibial collateral ligament. And lateral menisci is less liable to injury and medial menisci is more liable to the injury. Lateral menisci bears more weight as compared to the medial meniscus. Yeah, here you can see that the posterior fibers of the lateral meniscus, these are the posterior fiber of the lateral meniscus. They are attached to the femur by two bands. One band is this one and this one, and this is the PCL. The fibers which are connecting the posterior end of the lateral meniscus with the femur, that is called as anterior meniscofemoral ligament, which is anterior to the PCL, and posterior to PCL is the posterior meniscofemoral ligament. So anterior meniscofemoral ligament is also called as ligament of Humphrey, that is connecting the posterior end of the lateral meniscus with the medial femoral ligament, and posterior meniscofemoral ligament, which is running posterior to the PCL is also called as ligament of Risberg, and it is connecting the posterior end of the lateral meniscus with the medial femoral ligament. So these are the meniscofemoral ligament. Now what is the function of meniscus? Act as a shock absorber. It is deepening the articular surface, that's why it is increasing the congruence, and it is spreading the synovial fluid, so it is helping in lubrication of the joint. It and also when the femur rotates, it is also rotating with the femur. And medial menisci is the less mobile, so because it is more fixed to the tibial collateral ligament, that's why the chances to injury is more to the medial menisci. So meniscal tear, which is most common in the football players, and medial menisci is more prone to injury than the lateral meniscus because of its fixity to the tibial collateral ligament. And second reason is that lateral menisci, it is protected by this lateral menisci. Here you can see the posterior part of the lateral meniscus. Its fibers are attached with the popliteus muscle. So when during flexion of the knee joint, this popliteus muscle will pull back the fibers of the menisci. So the posterior horn of the meniscus is pulled backwards, that's why it is not crushed between the articular surfaces. So lateral menisci is protected by popliteus muscle, and medial menisci, which is more fixed, and that's why, and more fixed to the tibial collateral ligament, and it is less mobile, that's why chances to the medial menisci is more. And most common tear which occur in football player, it is the bucket handle tear. Here you can see in this diagram, the first diagram, bucket handle tear. This is the bucket handle tear. So these are this is about the ligaments. Now what is unhappy triad of the knee joint? The combination of injury, that tibial collateral ligament and the medial menisci and anterior cruciate ligament, they are usually injured in combination with each other, and this is called as unhappy triad of the knee joint. Now what are the intracapsular ligaments of the knee joint? ACL, PCL and the medial and lateral menisci, they are the intracapsular ligaments of the knee joint. Now we will discuss the bursa around the knee joint in the next session. Thank you.